My name is Jose Sousa, and I'm with the County Executive's Office here in Prince George's County. We're pleased to have you participating this evening in the COVID-19 Vaccine Latino Town Hall. Buenas noches y gracias por estar con nosotros esta noche para hablar sobre las vacunas contra el coronavirus. I am pleased to be your moderator this evening. We have the pleasure of being joined by several key members of and leaders of our county, and we look forward to having you hear from them directly about the important role that the county is playing in our vaccine distribution plan. You will also be hearing from our county executive, who will be speaking on those efforts. And in addition, we will be joined by Gustavo Torres, the executive director of CASA, District 2 council member and vice chair of the Prince George's County Council, Denny Taveras, and State Delegate Jocelyn Peña Melnick from District 21. Lastly, you will also hear from Irma Justiniano, a COVID-19 vaccine trial participant, who is also an experienced health promoter and advocate. Just wanted to cover a couple of housekeeping items this evening before we get started. We have secured the services of an interpreter who will be providing translation for all of our Spanish-speaking attendees this evening. Please take a moment to select the interpretation icon on the menu bar and select Spanish. If you'd like to switch back to the main channel, you may then turn it off if you wanted to hear directly from there as well. Some of our speakers this evening will be speaking Spanish on the main channel, and you'll be able to hear them directly through that channel. En este momento ustedes pueden seleccionar el idioma de español en la parte del toolbar que está aquí a nosotros para poder escuchar el traductor que tenemos para hablar con nosotros esta noche. Just a quick reminder for our panel to please be mindful of your cadence as you're providing your remarks this evening so that we are allowing our interpreter to speak in real time at the same time. Lastly, I want to thank everyone for pre-submitting their questions for this evening's meeting. If time permits, we're also going to be able to get to many of the questions that are submitted through the Q&A box this evening. If we don't have the opportunity to answer your question tonight, or if you have a question that comes to you after the meeting concludes, please submit them to pgctownhalls@co.pg.md.us. Again, you can submit those to pgctownhalls@co.pg.md.us. It is now my pleasure to introduce to you this evening our esteemed County Executive, Angela Alsobrooks.
Buenas noches, everyone. My name is Angela Alsobrooks. I'm your County Executive, and I want to thank you so much for joining us this evening. I am joined tonight by CASA Executive Director, Gustavo Torres, State Delegate, Jocelyn Peña Melnick, County Council Vice Chair, Denny Taveras, and our Chief Health Officer, Dr. Carter. I want to thank them for being here. We're also joined by our Acting Director of our Homeland Security, Ronnie Gill, and several other members of my senior leadership team. And I want to thank them all for taking the time to join us this evening. Our goal this evening is to provide an update on COVID-19 and our vaccine distribution plan. As more and more vaccine doses become available, we will be sure that Prince Georgians have the opportunity to be proud to be protected from COVID-19. Now, based on our latest 7-day average, our percentage of positive COVID-19 tests has dropped to 9.2%. As a result, indoor dining will resume on Friday, January 29th at 25% capacity unless there is a dramatic and unexpected change in our numbers. I want to remind you that we must continue to keep each other safe by avoiding gathering with people from outside of our households. We must continue to please wear those masks in public and practice social distancing, even as indoor dining is occurring. Throughout this pandemic, we've listened to the advice of public health experts when it comes to COVID-19 restrictions for county residents and businesses. And I want to assure you all that we will continue to listen to these experts going forward. A time will come when we need to loosen or eliminate our COVID-19 restrictions, but we won't make that decision unless it is supported by science. We continue moving forward with the rollout of COVID-19 vaccines. Effective today, January 25th, Prince George's County entered phase 1C of our county's vaccination plan for pre-registration. Phase 1C, you should know, includes seniors 65 to 74 years of age, health and human services and public safety workers not covered in previous phases, essential workers at high risk of exposure, such as grocery store workers, transit workers, and others. However, due to the limited supply of vaccines, our focus continues to be providing appointments to individuals in phases 1A and 1B, and these include healthcare providers, frontline first responders and public safety, seniors ages 75 and older, those in assisted living and other congregate facilities, and teachers, staff, and childcare workers. Now, I know many of you are concerned over who is able to sign up and receive the vaccine in Prince George's County. At the beginning of last week, we said that we would reset all appointments after February 9th because we did not want to cancel the appointments of thousands of Prince Georgians who had properly scheduled them. But we realized that we had to adjust to ensure equity in the delivery of the vaccine to our community, which was the most impacted in the state. And so once we realized that many from outside of our county were able to use a good number of appointments that were intended to go to county residents because of the state vaccination registration site, which did not prohibit it, our health department began to manually reset hundreds of appointments a day. We replaced those appointments with older seniors and workers in our county to ensure they were able to receive the vaccine. As we announced last week, going forward, we will make vaccine appointments available to our residents and those working in Prince George's County based solely on our pre-registration form, which you can find at mypgc.us/COVID vaccine. Again, mypgc.us/COVID vaccine. So as we continue to cancel and issue new appointments, we'll continue to send out private appointment links to qualified residents based on completed pre-registration forms. I encourage everyone who lives and works in our county in all phases to sign up for vaccinations using our pre-registration form. Due to the limited supply of vaccine, we will not be able to honor the appointments made by individuals who do not live or work in Prince George's County. I want to be very clear that, again, we are requiring everyone that lives or works in the county to fill out a pre-registration form in order to receive a vaccination appointment. So if you do not already have an appointment and you've not filled out this form, please do so as soon as possible to be added to our wait list to receive an appointment. While we are primarily vaccinating those in phases 1B and 1A at this time, we are encouraging all Prince Georgians to go online and complete our pre-registration form, regardless of what phase you're in. This will allow us to keep you updated on our progress. Our health department will follow up with those who have pre-registered and are eligible to receive the vaccine. We ask for your patience because our vaccine supplies are limited. It may be several weeks or longer before the health department reaches out to schedule your vaccine appointment, especially if you are in phase 1C. Appointments are being sent out based on our phase distribution plan, with the initial appointments now being provided to our most vulnerable residents and workers. Now, after you have pre-registered and once you receive an appointment through the health department, you should bring identification with you to your vaccination appointment and your insurance card if you have insurance. If you are eligible to receive the vaccine due to your job, you should bring proof of employment such as a work ID. As a reminder, these vaccines are free for everyone, regardless of insurance coverage, and we do not ask for your immigration status at your appointment. This is totally unnecessary. We do not ask it. I also want to issue a new call for volunteers to help our vaccination effort. Today, we're asking all volunteers, especially doctors and nurses, working or retired, to step up for Prince George's County. Please sign up for the Medical Reserve Corps, which you can find on our vaccine website under the Healthcare Providers tab, which is again, mypgc.us/COVID vaccine. While the service is called the Maryland Response Medical Reserve Corps, it is not limited to doctors and nurses. Medical and non-medical volunteers can sign up. Make sure to specify Prince George's County during the sign-up process. If you can, please consider volunteering today. Now, much like our testing rollout in the spring, our vaccine is now ramping up. And I want to ask you for your patience. This is an unprecedented effort to vaccinate hundreds of thousands of residents, and it will take some time. We will run into some bumps along the way, but I promise you that we will continue to correct any issues we find. We will be honest with you and open and transparent with you, and we will keep you updated. I want to urge you, please, to take this life-saving vaccine when you are eligible. This is our way out of this pandemic, and I would not ask anyone to do what I would not be also willing to do. As you may know, I have received both doses of the COVID-19 vaccine. I see Delegate Pena Melnick, she has taken the vaccine. I know that Gustavo Torres has taken the vaccine. Council Vice Chair Denny Taveras has also received the vaccine. And so we have been proud to be protected. And when we take this vaccine together, it not only protects us, but also our family, friends, neighbors, and those with whom we worship. Thank you all so much for joining our call tonight. Now I want to hand things over to our CASA Executive Director, Gustavo Torres, and thank him so much for being here tonight. Thank you all.
Mil gracias al Ejecutivo del Condado, a Alsobrooks, por la Asociación del Condado y su liderazgo. Bienvenidos a todos y todas a esta llamada. CASA ha trabajado muy de cerca con el Condado para responder a las necesidades de nuestra comunidad en esta crisis de la pandemia. Entre estas asociaciones se encuentra nuestro trabajo de navegación de pruebas de rastreo de contactos y exámenes de COVID, que ayudaron a contener la propagación del virus mediante la identificación de las personas con mayor riesgo. CASA también se asoció con el condado para guiar a los miembros hacia la asistencia por el desempleo y alquiler que el condado ha puesto a disposición, entre otros proyectos. CASA también ha trabajado con la Facultad de Medicina de la Universidad de Maryland en varios ensayos de vacunas COVID para asegurarse de que sean seguras y efectivas en las comunidades inmigrantes. De hecho, convertimos nuestro centro multicultural en Langley Park en un laboratorio para ayudar a facilitar la participación de los miembros de CASA. Y ahora, gracias en parte a los valientes miembros que trabajaron en el ensayo de la vacuna Moderna, ahora tenemos una de las vacunas más efectivas en la historia de la humanidad. Sin embargo, COVID todavía está teniendo un impacto devastador en nuestra comunidad. No hay duda de que ha impactado desproporcionadamente a las comunidades latinas y las comunidades negras. En Langley Park, por ejemplo, en el código postal 2783. Continúa desafortunadamente liderando el condado y en el estado en el número de infecciones desde el comienzo de la pandemia. Nosotros en CASA nos comprometemos a continuar trabajando con la ejecutivo del condado y su liderazgo para asegurar que nuestras comunidades que han sufrido de manera tan desproporcionada por el virus e incluso han contribuido al desarrollo de la vacuna sean priorizados para su distribución. Esta noche esperamos escuchar a nuestros líderes y expertos sobre la seguridad y eficacia de la vacuna. Y de hecho, tenemos en nuestras propias miembros y líderes de CASA. Está nuestra lideresa Irma Justiniano, quien nos dirá por qué participó en nuestro ensayo de vacuna y por qué ella piensa que es tan importante que nos vacunemos todos. Tener a todos vacunados es claramente la única forma en que todos salgamos de esta pesadilla del COVID. CASA y el gobierno de nuestro condado de Prince George harán todo lo posible para que esto suceda. Esta noche, comencemos por educarnos sobre cómo comenzar a hacer precisamente eso. Yo me vacuné y les cuento que fue súper sencillo, absolutamente sin ninguna repercusión para la salud. Por el contrario, me siento más seguro y ahora voy a estar dispuesto para la segunda dosis, que es en 3 semanas. Así pues, de que muchísimas gracias y espero que esta sea una oportunidad para educarnos todos. Mil gracias.
Muchas gracias, Gustavo, por sus palabras. I'd now like to introduce Dr. Ernest Carter, Prince George's County Health Officer, to provide an update and efficacy. Dr. Carter, thank you for joining us. You can unmute your.
Thank you, and good evening, everyone. Thank you for having me tonight. I wanted to start off by making sure you know that the COVID virus is still spreading among us. It is still making a lot of our residents very sick. We've seen record numbers of new cases this month, so we all must stay vigilant about staying safe and looking out for each other. Wear your mask. Please wear your mask over your nose and your mouth every time you're in public. Stay at least 6 feet from other people. Limit gatherings to only the people you live with. Keep your hands and your surfaces clean as much as you possibly can. And get the shot when it's your turn. We're working to give more first doses to people in phase 1A and B who live or work in Prince George's County as soon as possible. If someone is in phase 1A and B, please fill out and submit our pre-registration form so we can get you an appointment and as they become available. The website is mypgc.us/COVID-VACCINE. We really want to target our Prince George's senior citizens. They're so important to us and they're very vulnerable. If you're 75 years old or older and you are a Prince Georgian, we want you to get vaccinated now. Your age alone means you are at higher risk of getting really sick from this virus. I also want to make sure you knew that the health department is canceling first dose appointment for those who do not live or work in the county. For people who already received the first dose from us, you will be able to receive their second dose from us too. We will send you a notification. If you are in phase 1C and you live or work in the county, we ask that you fill out and submit the pre-registration form on our website so we can notify you when it is your turn to get the shot. Among those eligible for 1C vaccinations are people 65 years and older, essential workers who are at high risk for exposure, like grocery store workers, the postal service, or those who work for public transit, the public health and public safety workers who are not covered by 1A or B. Our vaccination efforts are escalating rapidly. We are now administering more than 1,000 shots a day at our 2 clinics. We're anticipating opening a 3rd vaccination site this week at the Southern Regional Technology and Recreation Center in South County. And we continue to expand our vaccination partnerships with trusted sources in our community. We're making great progress in this historic vaccination effort. The county is vaccinating people as safely and as equitably and effectively as we can. We're on the journey back to normalcy together, and I look forward to answering the questions you have. Thank you. Now I'll hand it back over to the moderator.
At this moment, Mr. Ronnie Gill, to provide an emergency operations status update on the logistics of vaccine distribution. Director Gill, thank you for joining us this evening.
Thank you. Vaccination and administration, we're utilizing the incident management, incident command system to manage the vaccination process. This is a system that's utilized by both health entities and public safety as we deal with major events. The overall vaccination distribution and administration process is managed by Dr. Carter, the health officer, and myself. And the day-to-day operations are managed by our personnel. Our vaccination distribution efforts are ongoing for persons who live and or work within Prince George's County. Logistically, we are planning a day-to-day storage and allocation of the vaccine, including the necessary resources required to properly maintain the vaccination once it's received from the various manufacturers. We have purchased 6 ultra cold freezers and 8 standard freezers for vaccination storage. We have planned to install the freezers at 3 locations at this time, and we have 5 others that would be installed at locations once those specific locations are selected. For our situational awareness, it's imperative for Dr. Carter and I to have real-time data throughout this entire process. Our WebEOC system will allow us to maintain situational awareness at each of our vaccination sites. This includes the number of vaccinations provided daily, weekly, and throughout this entire process, addressing logistical and resource issues that may arise, enabling the teams to utilize site performance metrics, and lastly, any other miscellaneous status information that Dr. Carter and myself determined we need to begin tracking. The Health Department and the Office of Emergency Management continue to work closely with the Office of Information Technology to review other tools they may be at our disposal to track the progress of our vaccinations. We are currently administering vaccinations at 2 locations, and Dr. Carter spoke of these. One is the Cheverly Health Center, and it's currently vaccinating individuals eligible under 1A and 1B. The Prince George's Sports and Learning Center is currently vaccinating individuals, again, county residents and or employees who are in phase 1B. We are preparing to open an additional site, which opened today for soft launch, but as we move through the week, we'll begin to vaccinate folks that are in phase 1B, beginning on Wednesday. We're in the process of finalizing an agreement and to open mid-month, mid-February, the Laurel Beltsville Senior Activity Center to begin vaccinating in our northern location. We're also phasing in 3 mobile units that we will locate or rotate around the county, one to assist individuals who are bedridden or unable to get to the vaccination sites. And this program will roll out in the next 2 weeks. It's important to realize that we have to train all additional staff that we're bringing on to be able to work at all of our vaccination sites, and then we get a bigger bang for our buck with our 3 sites, and then we'll begin putting the mobile units in service. Currently, all vaccinations sites operate by appointment only, but we will do on-site registration specifically at the, if we have seniors that are county residents who come to the Sports and Learning Complex, they can register on-site to receive their vaccinations. Anyone who would like to receive the vaccine must complete a pre-registration form on our website, and that is mypgc.us/COVID vaccine. That's mypgc.us/COVID vaccine. As we increase our vaccination efforts, site operations and locations may change based on the need. The county has made tremendous investment in the distribution and the administration of the vaccine. And as our county executive has said, we encourage you to remain patient as we navigate through this phase of the pandemic. This will be an ongoing process that will take us some time to reach all of our residents and employees. We must ensure this is done properly and in the best interest of all of our residents. Thank you.
Thank you so much, Director Gill. At this moment, we're going to transition to the next part of our meeting upon Justiniano, who is a vaccine. If you can unmute yourself. Remarks with us this evening about your experience.
Sí. Hola, buenas noches. Mi nombre es Irma Justiniano. Soy promotora de salud de CASA. Pues tuve el privilegio de participar en el estudio de la vacuna Moderna y también salí privilegiada de que me dieron las 2 dosis ya. Una fue en septiembre. Yo ni me percaté de que había recibido la primera dosis. Luego en octubre tuve la segunda dosis. Yo no tuve ninguna reacción alérgica. Yo no tuve ningún problema con la vacuna, con nada. Yo estoy trabajando, aparte de promotora de salud, de educar a la gente, que nos lavemos las manos, que guardemos la distancia y que usemos la mascarilla. Pues trabajo como probadora, como tester, ¿no? Saco pues la muestra en todo Montgomery. Todos los días estamos en esto. No me he contagiado, no he sentido nada. Y la semana pasada tuve la dicha que pues al descubrir cuáles habíamos recibido placebo y cuáles habíamos recibido la vacuna, pues yo fui una de las privilegiadas de recibir la vacuna y estuve muy contenta porque yo no he sentido absolutamente nada. Yo estoy reclutando a la gente para que vayan al segundo estudio que está empezando ya, y pues contándole mi experiencia y también invitándolos a que participen, porque es bueno nosotros como hispanos, pues que colaboremos en esto, y quien quita que también algunos saldrán privilegiados de recibir la vacuna antes que nadie, ¿no? A oscuras, pero bueno, está siendo buena, ha sido buena, fue buena para mí y pienso que es buena para todo el mundo. Yo también invito a todo el mundo a que se vacune, a que llenen su formulario y esperen su turno, que no se desesperen. Hay mucha gente que tiene miedo, pero hay mucha gente también que está a la expectativa de cuándo va a salir para ellos. ¿Qué era lo otro que iba a decir? Pues bueno, que vengan a colaborar con esto de la vacuna, que vengan al estudio, porque es importante que nosotros participemos como hispanos, porque vamos a salir nosotros también privilegiados con esto. Gracias.
Muchas gracias, Irma. Thank you so much, Irma, for sharing your experience with us. At this moment, I'd like to invite State Delegate Jocelyn Peña-Melnick to share with us your remarks this evening. Thank you so much, State Delegate.
Gracias, señor Sosa, y quiero darle las gracias a la ejecutiva Angela Alsobrooks por tener esta conversación que es muy importante, y también a los panelistas. Pues yo también recibí la vacuna hace una semana y los efectos secundarios fueron muy leves. Simplemente tenía un pequeño dolor en el área donde se administró la vacuna. Eso fue todo. ¿Ok? Así que yo le urjo a ustedes que se pongan la vacuna. Nosotros, las personas de colores, los africanoamericanos y los latinos, el COVID a nosotros no ha afectado, impactado grandemente. El condado con el número más alto de los casos de COVID es el condado de Prince George's, y el código postal con los casos más altos, más elevados, es el 20783. El 20783 es donde viven los inmigrantes, los latinos, que es Hyattsville, Chilham, Langley Park. En esas áreas es que hay muchos casos. Entonces nosotros tenemos que ponernos la vacuna. Le puede tener confianza. Los casos clínicos y los estudios clínicos, los latinos y los africanoamericanos tomaron parte en esos estudios. Es decir, que los científicos han mirado y han estudiado mucho la vacuna, así que es segura y es eficaz. Quiero que por favor tengan mucho cuidado de qué fuente de información ustedes confían. Busquen una fuente confiable, como si van a la página del internet español.cdc.gov, ¿ok? Que es con el gobierno, y le pueden tener confianza. No crean lo que oigan, ¿ok? Hay mucha mentira sobre la vacuna. Le pueden tener confianza. Por eso Gustavo, Denny, la ejecutiva Alsobrooks, y Irma y yo y muchas otras personas que trabajamos en la comunidad tuvimos la confianza de obtener la vacuna. Así que por favor póngasela para que se proteja, porque necesitamos inmunidad de comunidad. Muchas personas en nuestra comunidad que se la pongan. Y cuando usted se ponga la vacuna, tiene que todavía mantener la mascarilla, mantener el distanciamiento social, lavarse las manos con jabón. Por favor, es muy importante. Y le pido de todo corazón que se cuide y cuide a su familia. Y gracias por estar con nosotros hoy día. Thank you.
Thank you so much, Melnick. And again, thank you for the reminders that in addition to getting vaccinated, it's still important to maintain social distancing, to wear your mask, and to observe all the other behaviors that are important for us during this time. It's now my pleasure to introduce the Vice Chair of the Prince George's County Council, Denny Taveras.
Thank you. Thank you so much, Jose. And thank you to the county council member, Angela Alsobrooks, Dr. Carter, Delegate Peña, Jocelyn Peña Melnick y Gustavo Torres. Buenas noches a todos, a la ejecutiva y a todos estos distinguidos representantes que están aquí con nosotros. Es un orgullo estar aquí con ustedes hoy, esta noche. Y le quiero decir que vengo acá, lo que dijo, estoy completamente de acuerdo, no solamente con lo que ha dicho el señor Torres y la delegada Jocelyn Peña Melnick, pero lo que ella no ha dicho es que nosotros ya hemos perdido familiares a esta pandemia. Yo misma he perdido 6 familiares y he tenido en mi familia 16 infecciones. Y por eso para mí es tan crítico. Y este sábado pasado, antes de ayer, perdimos el papá del delegado Carlos Sánchez. Como le digo, esto es algo de urgencia para nuestra comunidad. Yo vivo dentro de el código postal 20783. Yo le puedo decir que lo estoy viviendo en carne propia cuando le digo que estamos sufriendo esta pandemia y tristemente en este condado, como dicen, tenemos hoy mismo 66,000 gente que están infectados, 17,000 de ellos, más de 17,000 de ellos son latinos. Y el secreto que no hablamos es la gente que no declara su raza, que de ahí hay más de 15,000 gente que yo sospecho mucha de esa gente son latinas. Y por eso yo digo, por eso, dado esta información, yo me vacuné. Yo me vacuné para asegurar que yo esté protegida. Yo tengo la primera vacuna, voy a tomar la segunda en febrero y yo sé que eso es algo para mí que yo investigué y siento súper cómoda con la seguridad de la vacuna. Con eso, yo le digo que también como nosotros lo hicimos, hágalo usted. Lo estamos, y no lo digo nada más para mi protección personal, pero lo digo para la protección de nuestra comunidad. Nosotros vivimos en casas, en hogares, perdone mi perrito que se quiere meter en el show. Vivimos dentro de nuestra comunidad y vivimos en casas con mucha gente. Todo el mundo tiene esa situación. Tenemos familias grandes. Tenemos que protegernos. Tenemos que proteger a nuestras familias, a nuestros viejitos, a nuestros niños y a los maestros cuando ellos van a la escuela. Todo el mundo tenemos que participar. Es como dice la Biblia, cada brazo, cada link es parte del cuerpo. Nosotros somos una comunidad. Y finalmente, dado como dijo la ejecutiva, vieron mucha gente de afuera del condado que se registraron para la vacuna. Por favor, tome el tiempo para pre-registrarse. Tome el tiempo, como dice Irma, no se desespere, porque yo también estoy en la misma situación que ustedes están. Y todos estamos esperando por las vacunas para el segundo dosis. Por favor, tome ese tiempo. Con eso, yo sé que no quiero respetar para que ustedes pregunten sus preguntas. Y con eso les digo que yo estoy muy orgullosa de estar protegida. Ese es el hashtag. Estoy muy orgullosa de estar protegida. Y si yo estoy orgullosa, yo quiero que ustedes estén orgullosos también. Y los quiero. Gracias.
Thank you so much, Vice Chair Danny Taveras. Going to transition into the question and answer portion of this evening's questions ahead of time. We're going to go through those first, and we have a few that have been entered as well. I'm going to start us off a handful of questions to our county executive. County executive, the first question under some of our panelists. You may have covered some of these remarks in your remarks, but it is important to help reiterate some of the key points here. So the first question is, what are some of the challenges the county has experienced engaging marginalized and vulnerable communities around the vaccine?
Well, one of the challenges that we've had is that Black and Brown communities have become are traditionally very distrustful of medicine because we have been mistreated in many ways over the years because of the health disparities. And so it has been a challenge for us in some instances to be able to demonstrate that this is a process that people can trust, that the vaccine is safe. We want everyone to know that we believe the vaccine is safe. We have taken it ourselves, many on this call tonight, but that definitely for our communities has been a big challenge in Black and Brown communities, is really just getting the word out that the vaccine is safe and effective, that it is important to keep not only us safe, but our families and loved ones safe. One of the other barriers to access for us has been also that sometimes navigating, especially the internet, can be a challenge for some. We want anyone to know who is feeling uncomfortable with the internet that we will also have a hotline so that you can call beginning on Monday if you feel uncomfortable navigating on the internet. Not to worry, we will have someone to assist you with a hotline that we are setting up. So really having access to information has been an obstacle. That's the reason that we are on this town hall tonight, coming to you. And again, we want to thank all of our partners who are on the call tonight, here to bring the information directly to you. We hope that you please share it with everyone you know and to those who you think this information may help. So it's just really getting out information about the vaccine, how to get it, letting people know that it's safe and effective and that we do encourage you to take it.
Thank you, County Executive. Another portion, you mentioned the importance of getting information out to folks. What steps in a little bit later in the meeting, what additional folks are receiving as possible around the opportunities for vaccination?
Okay, you know what, Jose, you went in and out a little bit. I don't know.
I'm sorry.
Sorry.
I'll try that again. Is that better now? Can you hear me?
Yes, thank you. Yes.
We are all internet challenges, so I appreciate your patience. What additional steps is the county make sure that we are targeting information around providing the opportunity for
Around providing the opportunity. I'm sorry, say please the last one.
Sure. What additional steps are we using to provide quality information so that they're aware of all the opportunities for getting vaccinated? You mentioned the hotline on that front.
So we have not only the hotline, we do have a website that I provided. I'll give it again. It's mypgc.us/COVID vaccine. You can go there and get information regarding the vaccine, regarding where to take it, information about it and its safety. We also are out and about. We have commercials that we are making sure that we have out. And so other public information on radio. And of course, again, on this particular site, just making sure that everyone has information about it. We're working, we want to thank Gustavo for being here from CASA in hopes that we can be able to share the information through a trusted source. Again, Delegate Jocelyn Pena-Melnick and our Vice Chair, Denis Taveras, is on as well. And so we're really making sure that we work with all of the trusted leaders in our community also to get the information out.
Thank you. And lastly, you mentioned this earlier, how important the issue of fairness around the vaccine. Can you again reiterate how it has helped inform the approach that the county is taking on such an important effort?
So let me just explain kind of how we got to where we are. I know Dr. Carter's on the phone as well. We initially, the website that we used allowed people from jurisdictions that were outside of Prince George's County to accept appointments in Prince George's County. And what we realized is that we had so many coming from other jurisdictions that we were not able to, with the short supply that we have, get vaccinated as many of our own seniors and own employees who were frontline workers, et cetera, vaccinated as we wanted to. So what we did was to cancel appointments for individuals who are not living or working in Prince George's County to make sure that the limited supply of vaccines that we have at this point are available and prioritized to those who are living and working in Prince George's County. We want to make sure that this is an equitable process, that those who live and work in Prince George's County have the very first opportunity to be vaccinated and protected. And we'll be working with other jurisdictions as well, but we wanted to make sure that we reserved our limited supply of vaccines for Prince Georgians.
Thank you so much.
Thank you.
I'm going to pivot now over to Dr. Askew, our Deputy Chief Administrative Officer. Vaccine be distributed to teachers and school staff?
So I think, Gustavo, you were asking when and how will the vaccine be distributed to teachers and school staff, and I'll be happy to answer that. And thank you for the question, and good evening to our Prince George's family. And thank you all for tuning in to learn more about how you can become proud to be protected. Currently, there are actually, I'm happy to say, multiple pathways that are being used to make sure that our teachers and school staff are being vaccinated. Canceling out of county appointments, those folks who were not members of the county or work in the county, has allowed us to begin booking Prince George's County public schools, as well as some of our private school partners, staff immediately. And then when I say immediately, I mean as in tomorrow, there will be Prince George's County public school staff being vaccinated at our sports and learning facility. Starting Saturday, January 30th, and going on until Sunday, January 31st, Prince George's County public schools staff and faculty will receive vaccination at sports and learning in large scale on multiple subsequent weekends. Starting the week of February 1st, that's next Monday, they will also be able to receive vaccines via a partnership with CASA Permanente. That will go on for 7 days a week. We will be notifying folks of opportunities to schedule appointments. Again, all of this is dependent on vaccine availability, but as we look into the near future, we are going to be moving fast and hard through getting all of our teachers and staff ready to be vaccinated, not just with one vaccine, but with 2 vaccines if 2 vaccines are required.
Thank you so much, Dr. Askew. There's a follow-up to that. Can you hear me okay?
I can, yes.
Thank you. One of the follow-ups is, will individuals who work in school organizations like PTAs and PTOs, will they be given vaccine access along with teachers and staff?
Right now, again, thank you for the question. Vaccination of school teachers and staff will be focusing on those individuals who are employees and in the building with students and staff on a regular and consistent basis during in-person instruction and other activities. While we would like to extend to school organizations like the PTA, they are not currently in a priority group at this time unless employed by the schools.
Thank you. One of the other questions we received is, Georges County Public Schools employees be given the Pfizer vaccine or
You broke up just a little bit, but I think you were asking whether or not they would be given the Pfizer vaccine or the Moderna. And it depends on what vaccine is made available at the time by the state. We don't control that from the county level, but what I can say to folks is that Pfizer or Moderna, the effectiveness of those vaccines is essentially exactly the same. The side effect profile, if you happen to experience any, the side effect profile is essentially the same for both of those. And so we are equally confident and equally happy to dispense one or the other, depending upon, again, what the state has given to us to provide.
Excellent. Thank you so much, Dr. Askew.
No, my pleasure.
I'm going to move over to the next round of questions here, and this one might be targeted to Dr. Carter or to Director Gill. Earlier that there had been some members of surrounding counties who had signed up to receive county. Are those people going to be allowed to proceed with getting their vaccines, or are they being asked?
You broke up a little bit. This is Dr. Carter. I'm sorry. But from what I understand, you're asking if people from surrounding counties, if they signed up, would they be able to get the vaccine in Prince George's County? And right now, the answer is no. We are concentrating on our citizens at this point. And we are making sure that our citizens get signed up. And unfortunately, those that did sign up, we had to cancel their appointments so that we could free up space for our residents.
Thank you, Dr. Carter. Again, my apologies if there's some hesitation the internet here. The next question is around our residents who are undocumented. Will undocumented residents be vaccinated? Are they eligible for vaccines in Prince George's County?
Absolutely. The health department does not ask for citizenship when we're offering our health services, period, to members of our community. So if you're undocumented, you're eligible. If you're documented, you're eligible. You just have to be a resident of Prince George's County, or you have to work here.
Thank you so much, Dr. Carter. The next question is around locations where folks are receiving their vaccinations now, and can you reshare where the proposed new locations might be? Director Gill, if you want to help us with that question.
Sure. The locations that are open currently are the Sports and Learning Complex, 8001 Sheriff Road in Landover, and the Chevrolet Health Department, 3003 Hospital Drive in Chevrolet. On Friday, the South Regional Tech Center Tech and Recreation Complex, and I'll type in the exact address. I believe it's 7002 Bach Road, but I'll get you the exact address and put it in the chat. And lastly, we're looking at the Laurel Beltsville Senior Citizen Center, Senior Activity Center in Laurel, and we're looking at the second or third week, somewhere in there, and opening in February.
Thank you, Director Gill. We have folks who've asked about specific conditions and where that puts them into their phasing. Questions is an individual who is 63 years of age, who has had a stroke. When might they be able to sign up to receive conditions?
Now, assuming that person is a Prince George's County resident or employee, able to receive that vaccine in phase 2. Under resident 16 to 64 years of age with medical conditions and who are at risk for COVID, that's when they will get vaccinated. I want to be sure that I let people know that they should visit the website at mypgc.us/COVID vaccine, which I said earlier, because we have a lot of information as to the phasing of the vaccine and the eligibility in both English and Spanish, if you go and visit that site.
And also, if I can just jump in, Dr. Carter, I also want, because I hear the concern, a person who's 63, who has a pre-existing condition and is very concerned about their health, you can also fill out the pre-registration form, because there may be an opportunity, for example, if we have some openings, that you may be contacted sooner than you expect. So pre-registering gives us an opportunity to reach out to you when there's an opportunity for you to be vaccinated. So we say pre-register now, get in the system, and then when, as the spaces become available, which may very well, depending on how we can ramp up, be sooner than we expect, and we can call and fill those slots in.
Okay. Around the second, after folks receive their first vaccine, really fill out a pre-registration form for the second dose, or how does that process work?
I'm sorry, you broke up a little bit.
I'm sorry. After folks receive their first dose,
Mhm.
do they do it at the location, or do they have to register through a separate process for the second dose?
No, after you get your first dose, you're registered in the state system, and you will be contacted to schedule your second dose. You do not have to pre-register after that. Once you receive your first dose, you're in the system. Now, you may not receive a notification immediately, but you will receive a notification, and you will be then scheduled for your second dose.
Thank you, Dr. Carter. So we have a question here in the chat. Someone's asked if they teach in Prince George's Public Schools and already have an appointment, do they have to go back and complete a separate pre-registration form, or do they keep the original appointment that they've already secured?
Is that question for me?
Yes.
I think it might be for,
So just repeat the question for me one more time.
sure.
I think Dr. Carter, because I know he's having a little trouble with the reception, I can tell you.
Yeah, I can hardly hear. I can't hear. I'm sorry.
Yeah, let me just help with Jose. I got it, Jose. The question is whether or not the person's a Prince George's County employee. They already have an appointment. And the question is whether they need to go back and pre-register if they already have the appointment. And I would say if you already have the appointment, but Dr. Carter, you can answer that one. But I would say they just continue, right?
That's right. If you already have an appointment and you have in your appointment, and you're a Prince George's County resident, and you haven't been canceled, then you just go to your appointment and get your vaccination.
I'm not sure that they're a resident, but they work in the school system.
If they work in the school system, if they either employed in Prince George's or you're a resident in Prince George's, and you have if you have an appointment, you will be honored. If you're in phase 1A or 1B.
Excellent. Thank you, Dr. Carter. So we also have a question here about workers who work in restaurants phasing they would qualify for to receive the vaccine. Would they be in 1C, or should we just suggest that they go ahead and pre-register and then they'll be called upon for that?
You said if they work in a restaurant?
Yes.
I'm sorry, you really did break up for me that time. I can't hear you.
Let's see.
I can step in and see if my reception is a little bit better. I know that Jose is having a little bit of an issue with the reception on his end. The question, Dr. Carter, was if someone works in a restaurant, when would they be eligible to receive the vaccine?
Well, right now, if somebody works in a restaurant, they would be able to receive the vaccine in the same phase that most people who work in an area like a restaurant, which would be in 1C.
Okay, so they should make sure that they pre-register now so they can get on the list, correct?
That's exactly right, because restaurants are essential services, and so they're in this first phase of getting vaccinated.
Okay, thank you very much. And we had one question. We've talked a lot this evening about the pre-registration process, and we got a question from the chat this evening. If you fill out the pre-registration form more than once, does this bump you down on the waiting list, or do you honor the first form that gets filled out?
We're honoring the first form that you fill out. it won't, if you do it twice, it won't bump you down, but we encourage you not to do that if possible.
Okay, thank you.
And
I think there's,
Jen, I just want to, and if you find yourself in that situation and you do get an appointment scheduled, we strongly encourage you to please go on and then cancel the other registration or somehow take it out of the system if you possibly can, just to help us so that we can make sure that we get someone else in there to fill your slot.
okay, and one other question, and I want to just stay on this topic for 1 second because there's questions about the pre-registration form and people getting calls. I know there was a time when we talked about how a number could show up on a cell phone when someone was calling for contact tracing. Is there a way, when this question comes from the chat, is there a way that people could know that they are being called to schedule their appointment? Are there certain times of day when these calls would come in, or certain numbers that it would come through that would be recognizable? Or are we just in a position where we're just encouraging everyone, if you know a call may be coming, to please make sure you answer your phone or return the call once you receive it? And that really could be Dr. Carter or Dr. Askew in that process.
Now, that's a good question. Currently, there is no way to know that we're calling you, but we're working on a way. So just like with the COVID, with the contact tracing, we want to be able to, for people to know and identify on your cell phone that it's us calling you to help you register for the vaccine. So that's coming. We haven't done that quite yet because the other one was done by the state. And the state hasn't done anything like that yet, but we have started to focus our efforts on that.
There's a question also in the chat I think is important to answer. I want to make sure we get it before we wrap up tonight. There are questions about individuals who are undocumented, who are concerned about the type of identification or proof they would need regarding living in Prince George's County. We don't want anyone to be discouraged about that. About identification. This is not an identification heavy process. We're just trying to make sure we serve Prince Georgians. But that, can someone answer, if you are undocumented, how does that person get registered if they do not have identification regarding work?
They have if somebody's undocumented and they live in Prince George's County, they have to have some proof of living in Prince George's County. If they work in Prince George's County, and they have to have a proof that they work in Prince George's County. Right now, that's where we are. Now, we need to go beyond that. We will have to have some discussion so we can figure out how to best do that. But right now, we have some identification as to whether or not you live in Prince George's County.
We understand we have not gotten to all of the questions tonight. So what we are going to do is take all of them down. Our team is going to work together to answer the remaining questions that we did not get to this evening. And we are going to post them on our website, and we will also share them with all of our panelists this evening. So you can share them out into the community as well if you would like. For those who would like to find the answers on our website, we are going to post them to health.mypgc.us/coronavirus. One more time, that is health.mypgc.us/coronavirus. And we will also share with all the panelists on the call tonight so they can send them out as well. We know there's questions about the hotline and other ones as well. So we will certainly get to all of those, and we want to thank everyone for participating this evening and for submitting all of those questions, and we will turn those around to you very quickly. We certainly also want to thank all of our panelists this evening. We thank you for all that you helped us do to promote this event and all of the information that you shared this evening. It was all, I think, very useful, very helpful. And we also want people to know that the website that I gave is a great place for you to go for continued resources in how we are addressing this pandemic and in how we are working on vaccine distribution. You can also find that by going to that website. So again, health.mypgc.us/coronavirus. And with that, I would like to just turn it over to our county executive for any closing remarks this evening.
Well, thank you so much, John. You did a wonderful job, I think, in saying everything that I would say, which is to thank you. Thank you to our panelists, our wonderful panelists who took time to be with us tonight. Thank you so much for all the participants who tuned in to receive the information. We are all in this together. We are going to work together as one Prince George's County to make sure that all of us are protected from COVID-19, that there will be no barriers to the protection or help or assistance that we give. Again, the information will be provided after this particular broadcast, but just know that we are here for you, that we care and want to make sure that all of us have the opportunity to get that vaccine and to be protected, not just for ourselves, but for our family, friends, and other loved ones. We are doing this to keep each other safe. So thank you so much again for taking time tonight. And we look forward to continuing to serve you. Thank you so much, everyone. Good night.
Thank you very much.
Good night. Thank you very much.
Good night.
Buenas noches a todos.
Buenas noches.
Buenas noches.
Buenas noches.
Gracias por estar presente.